I think a lot of people are resistant to therapy for so long because I think there's still that stigma, but also I think that just as a society, we have normalized medications so much. And so I think just to take a pill is maybe easier for people to, we also want that like quick fix. And therapy is a journey. It's not a quick fix. There's people in therapy, you could be in therapy for a few sessions to a few years.
I have learned that it is an essential tool if you want to live well with your bipolar. So I would like to hear from you, first of all. Number one, what do you have to say to people who are resistant to therapy? Like I'm sure you've encountered this before. So what kinds of things can you help people, help people understand why therapy is so beneficial? And then the other question I have after that, a follow-up question, is you talked about modalities. I didn't understand what that meant before. So maybe you can explain a little bit what modalities are and why they matter in therapy.
Yeah, absolutely. Those are great questions. So, yes, I've run into working in the mental health clinic as well as working in the middle school and high school. I run into all different, people or types of people that are resistant to therapy. Sometimes the client themselves, sometimes the parents. So it's very interesting because I think a part of it, how you said, and this is your story, but in my experience, I think a lot of people are resistant to therapy for so long because I think there's still that stigma, but also I think that just as a society, we have normalized medications so much. And so I think just to take a pill is maybe easier for people to, we also want that like quick fix. And therapy is a journey. It's not a quick fix. There's people in therapy, you could be in therapy for a few sessions to a few years, to all your life, depending. And I think a lot of people, I think it's a bunch of different reasons, but I think one is the stigma, one is the quick fix, one is that people don't want to really feel like there's something wrong with them when somebody says, or a doctor recommends, or a family member says, I really think you need to see a therapist. People often get very defensive and say, well, I don't need a therapist. There's nothing wrong with me. And there is nothing wrong with you. There's nothing wrong with going to a therapist. I like that it is getting more normalized, especially working in the middle school and high school. A lot of my students are so open about seeing a therapist or wanting to see a therapist. And that's actually where I run into this a lot, is that a student, we can only do so much in the schools. So we very often refer our students to therapists outside of school, and we'll call the parents and say, so-and-so is interested in going to therapy. I think it would really benefit them for this, for so-and-so reason. They're struggling with anxiety, depression, whatever the issue is. And the parents are like, oh, there's nothing wrong with my kid. My kid doesn't need therapy. They never told me anything's wrong. So a lot of times I find working in the middle school and high school that it's really the parents that are resistant. And when I worked in the mental health clinic, sometimes the parents would bring their child in and kind of force them into therapy. But after a few sessions, the resistant kid or teen, I worked with kids between 5 and 19, they ended up loving therapy and wanting to stay in therapy. But a lot of them did start out resisting because the parents were like, and I think it was also framed as, for a lot of them, there's something wrong with my kid here, like fix the issue. Yeah. So, so I think that's a part of the resisting, but I think, therapy is a very great tool for a lot of people. And like I said, a lot of the resistors ended up really liking therapy. It's a little different in private practice because unless it's court mandated, people really are coming in of their own free will and not being forced. But for some people, that does take a long time to get to that point. But as for your second question, modalities. So basically, these are different tools or specialties that therapists are more knowledgeable in. So there's different therapeutic techniques, basically. I'm trying to simplify this. So there's cognitive behavioral therapy that talks about the relationship between thoughts and feelings and behaviors. There's EMDR, which is I always forget the
Trauma.
full eye.
That's eye movement rapid desensitization.
Yes. So that's great. And they could all be for any sort of mental health issue, mental illness, but they are specifically for beneficial for certain things. So for bipolar disorder in particular, DBT is very helpful, dialectical behavioral therapy. So that's what's recommended for people that have bipolar disorder. Yes, EMDR is great for trauma as well as phobias. So it's different things that therapists specialize in, but you can have a therapist that isn't just specialized in one of these modalities, but uses little pieces from each, which is more of what I do. I use a little bit of DBT, a little bit of CBT, a little bit of mindfulness. There's so many new ones coming out all the time. So right now, one that's really big is internal family systems that people are finding a lot of success with. So if you have a particular mental health illness, look up which modalities are more beneficial for you and try to seek out a therapist that is specialized in that modality.